So at ASH this year, myself and all the group responsible for the FORTE trial, I think we gave a lot of important updates on the general population from a clinical point of view, and also in the evaluation of response to therapy. So the trial was finally ready for the survival analysis, and we were able to show that patients receive a combination of Carfilzomib, Lenalidomide, and Dex, plus autologous and cell transplantation, experience the best outcome in terms of progression-free survival. So those patients were the one with a prolonged control of the disease, but also with the deepest response. And so with this, I'm going to the second analysis. In this prospective randomized trial, there was a very, very well done plan of sub-analysis of minimal residual disease during and after therapy, both with conventional bone marrow techniques and with imaging outside the bone marrow. So we studied serially all the patients with flow cytometry, a subgroup of them with next generation sequencing, and a subgroup of them with PET-CT. So in the end, 108 patients were studied with both the technique, bone marrow, and imaging. So I think it's quite a big number of patients. They were studied at baseline, after induction therapy, and prior to maintenance. So from the bone marrow perspective, we were able to show a quite good concordance between the two methods, so flow cytometry and next generation sequencing. And of course, patients achieving MRD negativity and more sustained MRD negativity, so 1 year apart, one sample from the other, experience the best outcome. So I think it's a very strong result in terms of the prognostic significance of minimal residual disease negativity. And in this context, also the role of autologous and cell transplantation upfront was confirmed, because despite the prognosis was good also for patients not receiving autologous transplantation, those receiving both the combination of drugs and auto transplant experience a more prolonged sustained MRD negativity, so a reduced risk of early relapse. And I think this is very important. From the imaging perspective, as I said, 182 patients were studied serially with the two techniques. So we demonstrated and confirmed a complementarity between the analysis in the bone marrow and outside the bone marrow with the imaging, and this is important. We were able to apply the standardized definition of complete metabolic response that we previously demonstrated in a meta-analysis between different trials. So in this independent prospective series of patients, we applied this definition that we reached, and it turned out to be reproducible. So I think this is very important. And once again, patients achieving complete metabolic response by PET-CT experienced a prolonged progression-free and overall survival. And at last, patients completely negative inside the bone marrow with flow cytometry and outside the bone marrow by PET were those with the best outcome, as compared to those who were or both negative or one of the two techniques negative. So summarizing all together, I think that it is a demonstration of the value of minimal residual disease detection inside and outside the bone marrow in this prospective trial of approximately 450 patients serially studied. So I think it's a very consistent result. Regarding imaging, the next step is really to apply this standardized definition in several independent series of patients. This is something very new, so I think it is important to reproduce results also in other trials, and I know that other colleagues in other cooperative groups are using the same definition, so this will be something important. From the results in the bone marrow, well, by now, of course, we use this just to observe the patient and to split in different prognostic groups. So I think that the next step will be, of course, to use these results to tailor the therapy. And currently there are several trials ongoing that just started in Europe and also in US that are tailoring the treatment on minimal residual disease. So I think this is the logic fast after we have demonstrated that the technique is reliable, reproducible, and well, representative of the outcomes.